Go for it.
All right. So thank you for having us today. I'm Casandra Caesar, representative of the Louisiana State Ombudsman Program. So I'm going to tell y'all just a little bit about the program first while I'm passing out some materials. So we're a federal and state mandated program so the first handout is just a ombudsman, what you need to know, what we do, what we can't do, how we came about, all of that kind of information. And then I'm going to pass out to you our actual brochure that we hand out at long-term care facilities during resident council meetings and visitations that we go on there. So first off, we are a federal and state mandated program that addresses complaints and advocates for improvements in the long-term care system. So that means nursing homes and assisted living facilities. We don't do independent living apartments. That's a little outside the scope of our program. But if your person is in a long-term care facility, and that could be the rehab portion of that facility too, we can go advocate for their rights and for better care in the need. So, but we have to be asked to do that. So we need to be approached by the family or the resident themselves in order to get involved. If the facility themselves reaches out to us with a concern, we'll go meet with the resident in the facility to see, do you need our help, or are they just calling us in for yada, yada, yada. So we always work by what the resident wants. It's all about the resident's rights. So we are a residents' rights advocacy agency. We are not a regulatory agency. So Louisiana Department of Health is considered our regulatory agency. If we go in and investigate a complaint and can't reach a resolution on our regional level, that's when we send it off to LDH. But we always try to resolve the complaints at the regional level before sending it off to state. Typically it happens because they don't want state in there, you know, looking at things and doing things, because we can get it resolved on a lower level. They might receive citations and fines if it goes to Louisiana Department of Health. So the Louisiana Ombudsman program for this region, we cover 7 parishes. So we monitor over 60 different facilities within this 7-parish region. So we monitor Caddo, Bossier, Bienville, Webster, Claiborne, Red River, and DeSoto parishes. So if your loved one is at a facility in any of those parishes, our office is the one that you call. If we receive a call for anybody outside of those parishes, we forward it to the correct ombudsman assigned to that region. We have it broken down to, I think, 5 or 6 regions in our state. And Shreveport has some extremely intense cases. We'll put it that way. So we investigate and work to resolve reported complaints while honoring the residents' rights in the forefront. That's always what we want to put in the forefront, regardless of what the facility may want or think is in their best interest, or what the family may want or think is in their best interest. We're there to advocate for what the resident themselves wants.
Can you give us an example of the type of complaint that you would have?
Yeah, I can do that. So I'm gonna finish this real quick. It might give you a little more insight.
Okay.
So we will go into a facility, inform residents of their rights, advocate for and honor their rights and preferences while remaining objective. So we always kind of remain neutral between the parties. The resident always retains the right to make their own decisions and retain autonomy in their choices regardless of what others may advise, even if a power of attorney is in place. If they are lucid enough to make their own decisions and if the onset of dementia hasn't gotten to the point that the cognitive decline is, they're not able to make their decisions, then they can still override what a power of attorney is wanting to do within reason. So that's what we always say, within reason, because if they are going to the point of decline where they can't say with full understanding of what they're asking for, then it will default to the power of attorney. But to a certain extent, based on their BIM score and personal interviews, they may be able to override what a power of attorney wants to do. Like we had a case where they wanted to install a feeding tube. The family wanted it to be installed, the resident did not. She just did not want to be fed through a tube. She went through the swallow test, failed it, but pushed for a diet that was blended down, a puree diet, and she was able to do that for a little while until the medical necessity came in where they say, okay, you have to do this in order to survive. But she was able to say, I don't want that until it's necessary, and that's what happened. So we advocated for her right to make her own decision about her medical care because she was lucid enough to make those decisions. She just wanted to refuse care, which is within a patient's right to refuse care. So we don't always receive cases like that. Those are few and far between where we have to, step up against a power of attorney or something to say, hey, we do need to still respect their rights within reason until they come to a capacity point where they can't anymore. Resident's choice will always be reasonably, taken into account, and they can override POA choices. They can even revoke a POA, again, if they're lucid enough and understand what they're doing. If we have a case currently that a gentleman in a nursing home facility is essentially being defrauded by his family, and they're taking his funding, but we're advocating for his right because he is cognitively aware enough to make his own decisions. He just can't speak. He has to use a keyboard to communicate, but he can make his own decisions. And so we are advocating for his right to get an attorney to revoke the power of attorney and get some legal placement within there to review what's going on in his case to see if an interdiction can be done or, what can be done about that situation regarding his rights. So, like I said, in the forefront, we are a residents' rights advocacy agency. So we're always going to work toward what the resident says is their wants and needs that they want met. If this can't be done, then we involve other entities like Louisiana Department of Health to go take it a step further. So if you look, and here's two more for them. So if you look at this Ombudsman handout, what you need to know form, this is on our website. So you can go to the Caddo Council on Aging website and click Ombudsman, and it'll bring up a plethora of resources that we've added on there.
Good to know.
So we do have that up. We have some resources that we will be adding because there are lots being brought in to the area, more developing resources in our area.
Awesome.
Y'all being one of them. So, adding all those resources at this time. So what we do, each state has a long-term ombudsman program and state federally mandated. We look right here. These are the things that we will typically do. So we have a team here in Caddo region. I let them know we oversee over 60 facilities in a 7-parish region. So we have a team of 5 ombudsmen, and I'm the regional program director. I stay in the office the majority of the time and triage cases, follow up on cases, work with administrators to reach resolution, all kinds of stuff within the office. And I have 4 facilities that are outliers that I will go visit. So when I talk about visitation, we as ombudsmen have a contract with the state. It is the purpose of our program to spend at least 1 hour in every single facility that we oversee. So if we have 64 facilities at this point, we're having a few added on because they're popping up all over the place. But we have, each ombudsman has a caseload. So they'll have, say, 15 to 20 facilities that they have to go spend at least 1 hour, and that's what we call visitation. We go spend 1 hour in the facility unannounced, any time of day and night. I have ombudsmen that like to pop in at 3 or 4 in the morning just to see what's going on the shifts that nobody typically sees.
They can do that without being
Absolutely.
contacted by the resident or family?
Well, yes. So we, if we are asked by the resident or the family to come in and investigate a complaint, that's in addition to that 1 hour required visitation that we walk through peek into rooms, smells, sights, sounds, you know, is anybody loitering around asking for help and not receiving it? Is anybody moaning or groaning out in pain in their room? And, you know, just little things that when you walk through and pay attention to, bugs, you know, just random, like this just isn't quite right, or this should be done better, or why is that person standing at the nursing center asking for help but nobody's coming to help them? So all these little things that we take note of in our checklist and notebook when we go for our 1 hour visitation. But if we get a call, that's considered a case call. So we'll go in and speak with the family member and their loved one or the resident, whoever has called us in. We will go and sit and have an interview with them. What is your complaint? Have you brought this to the administration or the social worker or the DON's attention? If not, what would you like for us to do within, you know, do you want it to be an anonymous complaint? Because a lot of people feel retaliation. They're scared to speak up because they don't want to be punished for it, for saying, hey, this is wrong and I need better care, and then all of a sudden they're receiving even worse care as a result of that. So when we receive a complaint, we'll go in and do basically an interview and observe a lot. We won't necessarily tell them that we're coming in on a complaint. They may catch on to it because it's the second or third time we've been in a month, and they know we've already completed our visitation, but we don't tell them what we're there for unless we are given permission to do so. If we have an anonymous complaint, we will visit 5, 6, 7 different rooms and then present the complaint to where nobody knows where it came from. So there are ways that we can handle these things anonymously, but if we do have a case that is very pinpointing to one person's care, like if somebody is on a trach and needs certain care for that and they're not receiving it, there's only maybe 3 or 4 trach patients in the facility and they'll need to know who it is. So it depends on what the complaint is, whether or not we can go forward without a name and information. But if asked to do so, we will do everything in our power to address it as anonymous. In the event that we can't, we have a lot of great success with, you know, going in saying, this is the problem, this is what needs to be fixed. How are we going to reach resolution within 2 weeks' time? Let's get the ball rolling. And we find that we have a lot more success with resolving complaints in a timely manner that way than going about it from an anonymous standpoint. Because if we do anonymous, oh, well, we don't know where the problem is. If you can't tell us a name, then, you know, how are we supposed to help? And they can only do so much. But if we have a person say, hey, Mr. Jones is not having his catheter cleaned as often as it needs to be. He's been in the hospital for 3 UTIs recently. What are we going to do? What can we put in place to make sure this doesn't continue happening? And a lot of times just the facility and staff knowing that somebody is watching and paying attention will kind of straighten out what's going on. We'll watch and ask, you know, what solutions do you propose or can we put into place to try to make sure this doesn't happen again? And they can present A, B, and C. Okay, well, I'm going to give you 1 week to see how these go, and I'm going to check back in and see how it's going. And we will continue to check in every 3 days to a week, depending on, you know, what's going on with the family and what we're permitted to do to reach resolution. We had a case recently that we've had for a solid year, and pushing and pushing and pushing and pushing for certain things to be done, but this one facility, or not one facility, this particular facility, the administrator really dropped the ball multiple times. Every time we checked in, oh, we didn't send that off. Well, why not? We had a meeting about this. You were supposed to send that as soon as we concluded the meeting, and it's a week later and you haven't sent it off.
Can you share the name of that facility? I'm looking at it.
Yeah. So,
I think I guess the answer's no.
Yeah, we can't really get into that kind of stuff, but we can assist you with the admission process, essentially. You know, if you want to come in and make an appointment and sit down with me person to person and we can review some things, what your loved one's needs are, then we can match them with a facility that fits their needs really well.
Oh, that's great.
So-
So is this like, you know, when you get those public health inspections like restaurants, once the results, you know, are finalized, those get published to anybody who wants them. Do y'all have a system like that?
Okay, so we do a preliminary, what's called a pre-survey, where we go in with a checklist and look at a menagerie of different things, observations, and I can't get into it too much because it's a legal document that we're not allowed to share. But like, we're never supposed to leave one of those documents in there because it's very, very detailed of what we look for. And once we complete those pre-surveys, we send them to Louisiana Department of Health Standards section. So they are the ones that are the regulatory agency. They take all the information that we provide and go into the facility for what's called their annual survey. And that's where they get recertified to receive federal and state funding every year. So if we submit to them a pre-survey that outlines a lot of problems, they will go right to those problems amongst, you know, their entire review of what they have to do, but they will focus on some of these issues that we have experienced through the previous year with that facility. So a lot of times they will be put on basically a like preliminary watch. Like, we're gonna give you 30 days or to 60 days to fix these problems that we found, and then you're going to receive fines and penalties. And that can be anything from, they pull medical records from, like, if we say Mr. Jones has had multiple UTIs because his catheter had not been changed correctly or as often as it should have been, they will go and pull his file and 6 other people's files or whatever information that we've provided. You know, this person had an issue, this person had an issue, and they'll, you know, pluck some of those files in addition to the others anonymously that or randomly chosen files, and then they'll have a little stack that we have said, hey, check in on this one. And when they do that review, they'll go back, and when they write the report of citations, these are all the things that you need to improve in order to become recertified. You have 30 to 60 days to do this, depending on, you know, the severity of their infractions. And if they are able to put solutions in place and fix these things, then they get recertified for another year to receive federal and state funding for their facility. If they fail to do so, then their funding is plucked, and that's usually when we see buyouts and places going under, you know, is when they're not adhering to the federal and state mandates that are required for a facility to receive Medicaid, Medicare, Social Security, you know, veteran benefits, all these government benefits. They have to reach a certain level of approval of them adhering to state and federal mandates. Like, I need some water. Okay, so we will go in for minimal 1 hour to each facility in our region. Then if we're called in by family members, we will continue to go in as many times as we need to until the cases are resolved. So you will see your ombudsman if you're visiting at any hours. I mean, we'll come in the morning, afternoon, evening, weekends, 3 or 4 in the morning sometimes, because we want to get a full picture, a complete understanding of how this facility is run. In the after hours, when the administrator is not there, what's really going on. Are the residents receiving correct care over the weekend shifts versus the weekday shifts? So we see some askew kind of on the weekends that people will be on their phones, or no, that's not my job, or yeah, I'll be right back, and they never come back. That kind of stuff on the weekend shifts. Yes,
May
ma'am.
I ask a question? Does this apply to private nursing homes too, or just state operated nursing homes?
Private, I think we only have one private one right now, and I think it's Montclair, but typically nursing homes and assisted living facilities, they have to notify the state of their operation, and then in order to be considered a nursing home or assisted living facility, you have to have an ombudsman coming to observe, and you have to have Louisiana Department of Health doing your annual surveys to keep you certified.
The reason I ask, because some nursing homes, don't accept Medicaid, they don't accept Medicare and long-term insurance.
Right, and we still go see all of them.
Oh, you do?
Oh, yes.
Oh,
Is there one in particular that you're thinking of?
the Blake.
The Blake, yes, we do have an ombudsman assigned there. The Blake, so assisted living facilities generally don't accept Medicaid, they are out of pocket. Yeah, so, they have less federal and state funding, but they still will receive like Medicare or like Social Security benefits as a funding source. And in order for them to receive that as a funding source, we have to go in and check everything out and make sure it's running accordingly. I think those are the only ones right now that are not fully federally or state funded, are just the assisted living facilities and maybe like a pathways or something, one of the hospital linked rehab facilities.
The Glen, they come under this program
Yes,
too?
ma'am. All of their campus except for the independent living apartments. We don't do an independent living portion, but we do assisted living and nursing homes and the rehab units of nursing homes.
And memory care?
Memory care is included in nursing home as well. So we do pretty much all of it. If you have a person who's in long-term care, we're going to be able to go in and advocate for their rights. And if you call us and we're not able to, I can connect you to the correct source that will. I should have brought the Louisiana Department of Health complaint form because it has the numbers of all of the other entities. Like if you're in a hospital and have a complaint, then there's a number that you can call for that too. But
you can email it to me and I can send it to them, or I can come by the office and grab one.
all right, yeah, that'll work. We can get it to you. So, moving on is just as far as what we do. We'll go in, do our monthly visitation of 1 hour at least. We go in on calls, case calls for advocacy with any family member or resident that needs assistance. So when we go in, I try to encourage my team members, my ombudsman, go to the resident council meetings. And when they can, when their schedule allows, we will go and sit in on the resident council meetings at every facility. If you're unaware of this, ask your loved one, can I come with you to your resident council meeting? It requires them give you permission, but once you've gained permission, you can come sit in on the resident council meetings where they have, it's kind of like a roundtable meeting like this, where they put out an announcement over the speaker most times. We're having our resident council meeting, everybody please come down if you're interested, and people will come in and sit around, and it's all residents. A few staff, but the staff have to be given permission to sit in, because this is the residents meeting where they get to complain and say, hey, I don't like how the dietary department is running with this new person. She's not adhering to the diets that we're supposed to be on, whether it be puree or a diabetic diet or, stuff like this. During a resident council meeting, the activities director is supposed to call a meeting with everybody, as many residents that want to attend. It's open to anyone who wants to attend. Then they will, have the resident council president usually will say a prayer or welcome or something like that to get everybody kind of settled. And then the activities director will have a list of each department: nursing department, CNA, dietary, housekeeping, all the different departments that are working within this facility. And they'll go through each one and say, okay, dietary, does anybody have any statements or dietary needs that are not being met? And then you'll have people speak up, yeah, well, I'm supposed to be on a diabetic diet, but they brought me cake the other day on my tray. you know, certain things that they'll speak up about, and as an ombudsman or a loved one, you can kind of sit back and just take notes. And at the end of this, resident council meeting, the ombudsman will take the notes to the administrator. Even though the notes are going to be written up as minutes and put in a file and everything, we take it directly to the administrator and say, hey, were you aware of this? Did you know that this has been complained on for 3 months in a row at the resident council meeting and nothing's being done about it? And a lot of times they'll say, well, we're really understaffed. I knew about it, but it fell through the cracks. And we'll say, well, we're here to help you resolve it. What can we do to help you? You know, and a lot of it these days has to do with staffing. Like, well, my CNA said that they were going to come take care of this and they never came back. And I keep hitting my call button and nobody ever comes. So if we go to a resident council meeting at, say, the Blake, and we continue hearing 2 and 3 months the same complaints, we'll say, hey, your ombudsman, can we speak real quick? And, you know, when given permission, we'll say, we noticed that over the last 3 months you've had this same complaint. Do we have your permission to address this with the administrator? And the residents will give their permission, and we'll take it to the administrator and say, hey, we have some stuff here that needs to be addressed that's been brought up at your resident council meeting 2 or 3 times. We need to go ahead and get it taken care of so that it can drop off the complaints list and you can continue, you know, improving here.
How often are these, once a month?
Once a month.
I didn't know they did those.
Neither.
Yeah, so get in touch with your loved one, and oftentimes your program would be a fantastic presentation for one of those resident council meetings. So you can reach out to these facilities and say, I'd love to come present at your resident council meeting, and they'd be excited, you know, because that means they don't have to sit there and talk and receive complaints. But you know, I get up and give the spiel and, you know, hand out the brochures and stuff. So I'm going to hand out to y'all a brochure. You can take one and pass it around. And I'm also going to take one and pass it around. And you have to keep me notified about time, because I'll just...
Oh yeah, it's 11:30, so you're good.
Okay. So in this brochure, our beautiful little logo, you might be seeing some billboards up around town lately.
Yep.
We've been spending a chunk of our budget on community outreach and awareness because a lot of people don't know we exist. And we are about to put stands up in the front of each nursing home and assisted living facility that we oversee with these brochures in the stands, so that we're increasing awareness of our program and so that people know you can call us for help. So if you look in our handy dandy notebook, we a little Blue's Clues reference for everybody. What is an ombudsman? So we advocate for residents of nursing homes and assisted living facilities. Where a local ombudsman is assigned to every long-term care facility they go in and visit on a regular basis for 1 hour a month at minimum. We investigate concerns and work towards resolution of issues within the facilities, provide long-term care information to interested individuals who may be looking to put their loved one into a facility. Do you have a question?
I live in Bossier.
Oh, you do?
So, I mean, does this apply to Bossier?
It does.
Also?
We oversee 7 parish region for Caddo region, and Bossier is in our region. So we have, what was it? Oh, let me see them again.
Caddo, Bossier, Bienville, Webster, Claiborne, Red River, and DeSoto.
Right. I've never been able in 4 years to memorize. So bad. But, okay, and we attend resident and family council meetings. So family council meetings, basically, those don't happen too often. That's when a family creates the council, like family members, and all the family members get together. Mm-hmm. Most family members currently are just asking to attend the resident council meetings because they just haven't taken the effort, I guess, the facilities to create a family council. But we also attend what's called care plan meetings. So if we receive a complaint and we bring it to the administrator and they say, oh, well, they're kind of spinning their wheels or they don't know what to do, we say, okay, let's call a care plan meeting with the family, the resident, the administration staff, and the ombudsman staff. Let's figure out what we can do to get this fixed. We don't like to have complaints just open and sitting for too long. We want to bring a resolution to the families, make sure the resident is happy, their needs are met, and that they know that they can continue to call on us for advocacy when needed. We have what we call some frequent flyers. Boy, they know they can call us and receive help. They're like, Miss Kayla, yes, I'm here. What do you need? They know that they can call us and we will show up, talk to the staff, and the staff is likely going to move quickly with resolution versus if they were just asking for it themselves. So what type of concerns do we usually help with? And this is going to answer your question. Involuntary transfer or discharge is the number one thing we're reached out to for assistance. Appealing a discharge that is unlawful or involuntary. So sometimes we'll have facilities that want to get rid of a resident for being, just difficult, or we can't meet their needs when really they can, they're just difficult, or they complain too much, or the family members might be a little difficult because they're demanding these things be done, and the staff's, we're doing the best we can. So from time to time, we will get an involuntary discharge sent to us. They have to send them to us or else it's illegal. We have had instances where facilities have taken the resident to the hospital and essentially abandoned them there, saying we're not taking them back. And that's unlawful. You cannot do that. That is abandonment of the resident, and they can be fined heavily for that. So what we do when we're notified of something like that, I get my OLAP on, okay, so OLAP is an abbreviation for Ombudsman Legal Assistance Program. So I get my OLAP attorney, Chanel Jackson, she is awesome, on the case, and within 2 or 3 days, we have it squashed, and that resident is being taken back to that facility, or either if they are not treating that person well because we forced them to take them back, we'll assist the family on getting them placed in a different facility. We advocate for these rights, we facilitate these things. So yeah, involuntary transfer or discharge. If you receive any kind of notice that your loved one is being discharged from the facility and you do not agree with it, reach out to us and we will appeal it and we'll get them to keep them there. 9 times out of 10, they do want to stay there because it's their home. It's where they've been at for a while, or they've become comfortable there. So we will advocate for them to stay unless they say, I don't want to go back there, but it's wrong that I'm being kicked out. So we will still hold that facility accountable for getting rid of the resident in an unlawful manner and report them to Louisiana Department of Health, and they will provide the regulatory, I don't want to say punishments, but they will, consequences for, setting the person at the hospital and saying, we're not going to take them back for whatever reason. Sometimes we'll have the residents that they're being sent out for a UTI, a very basic condition that will require, hospital stabilization, but then once they're stabilized and the facility doesn't want to take them back, well, why? We investigate, well, there's really no reason. You can meet their needs. Yeah, they may complain a little much, or if they have dementia onset, they may become a little combative, but you accepted this resident knowing all of this. So that's what we will always go back to is, okay, now you're saying this person is a problem resident, but you admitted them knowing that they had behaviors, knowing that they had onset dementia, that they were having these issues. So we will work with the family and the resident to get them where they feel happy and safe, but if they need to stay in that facility, we will appeal that discharge to where they get to stay in that facility. Request for assistance, that's basic, it could be anything. I don't feel that I'm receiving correct care from the CNAs. We'll go in and make sure, hey, what kind of care, we'll talk to the resident first, what's lacking. Are they treating you right? Are they handling you too roughly? Are they giving you water when you're asking for it? Just, you know, any kind of assistance that just falls into that basket. Lost property. We've had an uptick in this recently with iPhone chargers, iWatch chargers, iPad stuff, phones, like these things in addition to clothes. We used to just get clothes. You know, my clothes are missing or my shoes or this or that, but there's been a lot of electronics and chargers lately that we're, you know, having to track down and watch video and, oh, well, this CNA took it from their room and was using it at the nurse's station to charge their phone. Now where is it? You know, and if we can't relocate it, guess what? Facility's replacing it. You know, it shouldn't come out of your pocket. If the item went missing during their stay and it wasn't a family member that took it out of the facility, then the burden is on the facility to replace that item.
What about lost teeth?
Yeah.
When they have false teeth.
Yeah, they could, depending on the situation, if we watch back and see that, you know, a nurse or CNA threw them in the trash can, we're like, okay, well, y'all have to replace them.
This is assuming that you've got a camera in the room, right?
Assuming, but, some places you're not allowed to have cameras in the room, some you are. Most of them that allow the, cameras in the facilities, it's your responsibility to get the Wi-Fi installed or the, you know, line put in and the camera and all that. But yes, we've had just hallway cameras catch things before. Yeah, so when a lady was being taken to the shower, we could see a CNA pocket a necklace. So, you know, you'd be surprised what we can catch. If there are just any kind of cameras in the facilities, period, we can go and ask, can we watch this back? And we've caught abuse and all kinds of things. We caught a CNA rolling a woman backwards into, and you're never supposed to roll anybody backwards. It's a hazard. So, because they can fall out. So she's rolling her backwards in order to get her into the shower because she's refusing to shower, which is within her rights to a certain extent. If she starts, you know, it reaching a certain point, yes, we have to, that's when hospitalization is encouraged and they will do that. But rolling her backwards into a shower area and she's grasping against the walls and ends up sustaining an injury behind closed doors in the shower area. But enough was caught on the hallway to sustain our, you know, complaint and forward it to Louisiana Department of Health that abuse had occurred, and they were held accountable. So, you know, there are a lot of things that if you just say who was observing or who was on the shift at the time and talking to them, or watching back cameras in the hallways or in the rooms, you can see a lot. Being treated with dignity and respect. We get a lot of calls directly from residents about that one. They spoke to me poorly. She yanked me around and it was unnecessary. People getting yelling matches and stuff, like just verbal altercations and stuff like that. So we'll go in, investigate what happened, see what staff members were involved, and do what's called an in-service to explain to them, like if for an Alzheimer's patient, they may not remember you, or they may be taken back to a point in time where, you know, things are difficult for them to understand and grasp because they are in place A and you're in B and there's a disconnect. So we try to do in-service trainings so that the staff understands what they're dealing with residents, you know, cognitive decline and just a lot of different stuff. Respect for personal privacy. This one, you know, closing the door when they're being bathed or changed, not just leaving it wide open or the curtain pulled, you know, making sure that they're feeling that they're being treated with dignity and respect. Exercising personal preferences. So, this one, This one becomes convoluted a little sometimes because what is best for the resident may not be what they prefer. So we sometimes are called in to advocate for the resident's right, a diabetic resident's right to eat cake if he wants to. And we have to go in and say, now you know that you're diabetic and you're not supposed to have this cake, but it is within your rights to eat it, but you have to know the consequences that you may suffer if you eat this piece of cake, sir. You know? So we really have to stress to them, this is not in your best interest, but we are still gonna advocate for your rights because you're a human being, you retain your rights, and this is what you want. You know, we treat that with dignity and respect to the last moment. So, I was stating earlier, we had a lady a couple years ago that was wanting not to have a feeding tube placed, and we advocated for her right to refuse treatment because she did not want it placed. Her family wanted her to, and she was losing weight and she was not doing well. But it is her right to refuse that treatment, like a cancer patient. If they don't want to go through chemo again, it is their right to refuse that treatment. So, Ombudsman services are always free of charge and confidential. So until you give us permission to say, Jim Bob in room 402 is complaining about X, Y, and Z, it is an anonymous complaint and we handle it from that perspective. We only do what we're given permission to do. Again, these are just some of the rights that we're called in to advocate for more regularly than others. If you look at this page that I handed out to you, this is a complete list of residents' rights that we have had to advocate for in the past. It was like a little book, like, were there not enough?
I don't think so.
I pulled off like 20 and kind of passed on.
I'm sorry. I'm holding it up down here, I'm sorry.
I was just gonna say, I'll hand you the pad, but I hand you like a mini pad.
It's out down here.
Yeah. They're good to have. You can take a whole pad if you want. So these are a list of all the rights that we have over the course of our ombudsman program come in and advocated for in the Louisiana State Ombudsman Program. So we like to visit resident council meetings and review these rights on a regular basis with our residents. And 9 times out of 10, we will have somebody raise their hand and go, I had no idea I had that right. One of them being, you have the right to ingest a reasonable amount of alcoholic beverages.
I saw that one, I was like, okay.
You have the right to smoke cigarettes out in the smoking area at the designated smoking times. That's by their policy that you agreed to when you signed the admission, stuff.
Yeah.
We get a lot of people calling in going, but they won't let me smoke. And I'm like, let me come in and I'll review their admission policies where they sign upon their admission. And it, sure enough, it'll say, you can smoke between the hours of blah and blah in the designated smoking areas, which is here and here. And once I review that with the resident, well, all right, fine. And then they'll adhere to what they say. I'll say, well, you signed it when you came in, so you were aware of it. They didn't just spring this on you. And if they do spring something new on them, like, oh, we have to hold your lighters and we have to hold your cigarettes, but that's not something that was, active before, I'll go in and say, well, where is it in your policy? You can't hold, you can't just change these things up without it being written into your policy. So we need to go ahead and get on that, write it into your policy, and then you need to have all these people sign that so that they're in agreement. Because right now, you're just encroaching on their rights. Because, you can't smoke in the building or around people with oxygen tanks, of course, stuff like that. But, if they said you can smoke at any time of day, and now they're saying you can only go between 8 a.m. and 9 p.m., 8 a.m. and 9 a.m. and 8 p.m. and 9 p.m., then, that has to be written into policy. So there's a lot of rights that, you know, people don't really know that they have. And sometimes facilities kind of count on that so they can fudge things and you're not complaining about things. It makes it easier for them when you don't know your rights. So to exercise your civil and religious liberties, if you want to go to church, you're allowed to go to church. They can't tell you, no, no. You get your transportation van and, you know, make the coordination, or a cab or a family member or whomever, but they still retain their right to go to church when they want to. Be informed of your rights and the rules, regulations of the nursing home has to be in their policy. If they're going to enforce it on you, it has to be agreed upon. To be informed of a bed reservation policy for hospitalization. This goes back to that involuntary discharge. If they take them to the hospital and they don't keep a bed reserved for them during their hospitalization, that's a violation of their rights. To be told of all services available and all costs, including charges covered and not covered under their benefits. So, you know, if they are wanting a service and it's available, they deserve to know about it, you know. One of the more recent things that is linked to this is counseling. After COVID, we found that there was a huge increase in anxiety and depression with these residents in these homes because the isolation was so intense for them that it really caused a need for mental health counseling within the facilities. So a lot of people don't understand or don't know that community-based counseling services are available in our region, that they will come into the nursing home for 1 to 3 hours up to 3 times a week to counsel your loved one and get them to where they need to be mentally and emotionally. So those services are available and are included in Medicaid. They're covered by Medicaid. So if your loved one you feel could benefit from counseling, contact a community-based counselor that takes Medicaid and get that service started for them, and you can work in tandem with your staff at the nursing home. A lot of, you know, benefit coming out of that right now. To be informed of your condition and plan treatment, and participate or refuse that treatment. So they can't just bring in a medication and say, hey, take this. They have to explain, what is this being prescribed for? What condition is it treating? To receive prompt response to all reasonable requests and inquiries. If you're asking, hey, how much money do I have in my account? And they, you know, keep putting it off and keep putting it off, you have the right to know those things within a reasonable amount of time, not a week or 2 weeks, but like a day, you know. To be transferred to discharge only after reasonable notice has been given and only for medical reasons, for the welfare of others, or for non-payment. So if you're in a situation where your loved one is being discharged for non-payment of services, contact us. We can still appeal this and get possibly some of the charges dropped or services. We can work with the attorneys to get them to stay in the facility even though they haven't paid for the services, 8, 9, 10, 20 grand that they owe. Right, we run into this very often, that there are all these services that have been rendered and not paid for, but the family is trying, or they have money in the pipeline, it's coming, but they're trying to discharge the resident. Call us. We can appeal that, and with the proper information, we can show X, Y, and Z is being done to alleviate this. We just need time. It's coming. We just need time. So that's there. The second part of that, resident can't be transferred or discharged from a certified facility based on source of payment for care charges. That's what I was just talking about. So to be encouraged to exercise your rights as a citizen, that's like voting. If you want to go out and vote, they have the right to vote, and transportation should be provided for your loved one, that resident, to go out and vote and practice their rights as a resident and citizen, their civil liberties. To receive adequate, appropriate health care and protective and supportive services. pretty self-explanatory. To be treated courteously, fairly, and with the fullest measure of dignity. So if CNAs are getting rough with them or treating or speaking to them inappropriately, let us know, because those people really don't need to be there, because this, this is your job. This is what you're going to be doing on a day in, day out basis. If you're already verbally abusing residents, it's not the place for you. So we do want to be notified about that. To manage your personal affairs, and if this is delegated, to receive an accounting summary every 3 months upon request, and within a reasonable amount of time. So if you say, hey, I want to see what you're spending all my funding on as a resident, they should give you a readout of this is where all of your funding is going. All right, free of mental and physical abuse and of restraints not documented medically as necessary. So we will advocate against chemical restraints too, not just physical restraints. So if your loved one is being sedated, like you go in and they're loopy and can't put words together and you're like, what is going on? Oh, well, we gave him his Xanax PRN because he was a little combative. If you feel that your loved one is being chemically restrained, sedated, let us know, because that's a loss of quality of life, to refuse to serve as a medical research subject. That one doesn't happen often, but we have had it to where somebody was getting basically scammed by outside sources saying that they were a medical research facility and yada yada. So keep an eye on that. You had to have your personal and medical records treated as confidential, but you also have access to them at any time. So if the resident wants to see their medical file, they can ask, I want to see what's in here. And there may be a lot of jargon that they don't understand, but they still have the right to access their medical files at any time. To be treated with consideration and respect for your personal privacy, not to perform work, to receive visitors and private mail. During COVID, the visitor situation kind of got a little gray area for a while there, and a lot of facilities tried to kind of hang on to that authority. Well, we're not going to allow people in and yada yada yada. That is no more. Even if there is an outbreak of COVID in the facility, they cannot turn away visitors. Illegal. So remember that, because we will walk up to facilities from time to time with the COVID thing on the door saying, warning, no visitors. That's, you are allowed to go in and visit your loved one regardless of what's going on in the facility. Wear a mask and the proper PPE to protect yourself and others, but you're never banned from visiting your resident. Right, so take part in various activities in the nursing home. Right now, we have a nursing home that has 0 activities, and we don't feel that their minds are being engaged at that place, so we're advocating for their right to have various activities in that facility. They didn't even have a radio. We're like, so what do people do? Just sit up and sit on the couch and stare at the wall. That's it, in a memory care unit. I'm like, that's just cruel. What are you guys doing? So, to have their rights to their activities, to have their own clothing and possessions, to use tobacco in accordance with the applicable policies, rules, and laws, to consume a reasonable amount of alcoholic beverages. So you can't have like a 6-pack a day, but if the doctor says, I approve a glass of wine per night, then they're able to have their glass of wine, or a beer, a reasonable amount of alcoholic beverages. Unless it's prescribed against. If the doctor says no alcohol for you, then we're going to say, sir, you're not supposed to have that alcohol, just like the diabetic's not supposed to have that cake. But to have your choice in pharmacy and physician. We run into this, let's get privacy to visits with your spouse, conjugal visits. So your choice of pharmacy and physician, we do run into this because sometimes the physician that's at the facility, they don't feel that they're getting the correct care that they deserve from this person because he or she is spread too thin over 10 or 15 facilities, and they want to go to their doctor. This is allowed. This is within their rights to choose their physician and their pharmacy. To withhold payment of physician visitation if the physician did not examine you. This we run into as well, that the facilities will report, yes, our physician saw them and they, have not. Oh, well, I saw a nurse practitioner, but I didn't see my doctor. I wanted to see the doctor. And, they can call and say, hey, I haven't seen the physician, but they're trying to, charge my Medicaid and Medicare that I have. So we'll go in and say, hey, no, that's fraud. You cannot commit Medicare fraud saying that you saw a doctor when they never saw a doctor. What are we gonna do to fix this? And they'll call the doctor and see him. It's a pretty quick fix for that one. To have ample opportunity to visit with family and friends. They can't confine your visitation, what they're saying. You get ample opportunity. To retire and rise in accordance with reasonable requests. We had a gentleman that was being woken up every hour on the hour for medication and observation, and he was hating it. He's like, I can't even sleep, like I'm literally gonna die because I'm sleep deprived. And so we went in and said, hey, do y'all really need to wake him up every hour on the hour? As soon as he gets back to sleep, you're waking him up again. He's gonna die from sleep deprivation in like 5 days. What can we do? So within reasonable requests, they backed it up to every 3 hours. His condition required continuous monitoring, but every hour they'd stick their head in and make sure that he's okay and everything was still beep beep, all his little vitals were still fine, but didn't wake him up except for every 3 hours then. So even though there's not much we can do, we may be able to do something to help, get him back. Okay. To choose your roommate whenever possible. So roommates, if you have a loved one who's in with a roommate and they don't like their roommate, you can ask to be changed to a different room, or their roommate can be put in a different room. Typically the person who is requesting the change is the one that's moved out of the room. To have any significant change in your health status reported to you. So if you have a decline or an improvement, this should be reported to you, right? So that's that. Do y'all have any questions?
I have, inspected 4 possible memory care units.
Are we
on
still
my own.
recording?